Residents of two blocks in HOUGANG and one in YISHUN getting tested for COVID-19 after viral fragments were found in wastewater. Going into a full lockdown, Malaysia shuts most factories and malls, with people only allowed to go out for essentials. And the tennis world reacts after Naomi Osaka withdraws from the French Open following her media boycott. You're watching The Big Story, coming to you live from the Straits Times newsroom. I'm Haryanto Diman. You can subscribe to the Straits Times channel so you never miss a single episode. 15 new COVID-19 community cases confirmed today, with 7 currently unlinked. The other 8 are linked to previous infections, with 6 cases detected while already on quarantine and 2 identified through surveillance. 3 imported cases were also reported today, 2 being Singaporeans or PRs. The Health Ministry will share more details tonight. Mandatory COVID-19 testing is underway for those living at blocks 501 and 507 along HOUGANG Avenue 8. Earlier this month, residents of block 506 went through the same exercise after some cases were detected there. In the instance of 501 and 507 though, there are no known cases yet, but traces of the virus were found in wastewater samples from these blocks.
There are no known cases yet, so it's only a suspicion based on traces of the viral fragments of the sewage. And also to clarify that this is nothing to do with transmission through sewage. It's actually MOH or the authorities have been testing the sewage to detect whether or not there are traces of COVID-19 inside the sewage.
Mandatory testing is also being carried out for all residents of Block 745 YISHUN Street 72. The Health Ministry said surveillance testing detected 6 cases from 2 households, with subsequent wastewater testing detecting viral fragments. Investigations are ongoing to determine linkages as well as the source of transmission. DIY antigen rapid test kits will be piloted at construction work sites for those not living in dormitories. Generally conducted once every 3 days, these tests will be on top of the PCR rostered routine testing that these workers are mandated to take. The Building and Construction Authority said today that each employer will appoint trained personnel as supervisors to ensure the kits are correctly used. Some work sites will also designate and train specific personnel who administer the swabs for their colleagues. President Halimah Yacob today urged unvaccinated seniors, around 280,000 of them, to get their jabs quickly, also calling on neighbours and friends to assist this group. She stressed that the vaccines are safe, referencing the 760,000 seniors who've already been vaccinated. As the virus looks to be endemic, and if Singaporeans want it to be similar to a flu-like disease, regular COVID-19 vaccination, perhaps once a year, will be the new normal. That's according to experts today speaking on a Straits Times panel.
That at some point, we will continue to see COVID-19 being included as part of our national immunization schedule for both adults and children. And perhaps we will need regular booster shots from time to time to make sure we continue to be protected, especially against any new emerging variants.
The panel also discussed the safety and effectiveness of vaccines, as well as Singapore's preparedness to tackle future outbreaks, ongoing issues as we continue to battle COVID-19. One of the key points was the importance of vaccinations in reducing further virus mutations.
What happens in a mass vaccination paradigm is that you reduce the opportunity. The virus can't transmit so easily, it doesn't take root so easily, it doesn't pass on. And then even if it infects somebody, the duration of infection for a vaccinated person is likely to be much shorter compared to somebody who's not vaccinated. So all these reductions in exposure in terms of numbers of persons, in terms of transmissions, in terms of duration, all this will reduce opportunities for mutations to occur. So I mean, for example, if we had been able to stop the virus in Wuhan itself, before it got out, we will not be talking about B1617 or B117, right? Because it has not had the opportunity to mutate. So I think the vaccination is critical in terms of stamping out the opportunities for further mutations.
And answering questions from viewers, the panel addressed concerns about vaccine efficacy, saying that every individual will develop different levels of immunity based on their health conditions.
We have been following some of these vaccinated individuals, and actually most of them sort of respond pretty similarly, but that could be a small number that may not actually react the same way, and I say it could be due to other conditions that is not related. But most of the time, it would actually protect. And even for those that had the vaccine breakthrough, these are the individuals who also more or less suffered a very mild, very, very mild symptoms that were explained by Prof. Teo earlier. So in other words, it could still actually manage the whole infection in a much simpler manner compared to someone who is actually not vaccinated.
So vaccinated people, by and large right now, we see that most of them have very, very mild or completely no symptoms at all. That one person that we have seen so far out of 93 had more severe symptoms because that person actually had some prior conditions, prior health conditions that predisposes that person to a more severe infection. Not just our local data, but international data, especially from the United States, where they have vaccinated more than 100 million people, clearly suggests that vaccinated people, even if they're infected, very mild symptoms or practically no symptoms at all. And I think that is a very important message for us to remember, because that is exactly where we're aiming for in terms of our long-term game plan on how we exit this whole COVID-19 crisis that we are in right now.
Looking across the causeway, with Malaysia going into a nationwide lockdown from today. Now slated to last for 2 weeks until June 14th, it comes as the country reports record numbers of new cases daily. With a strict work-from-home mandate and most businesses closed, streets in the capital were generally emptier earlier. Ahead of the lockdown last night, Prime Minister Muhyiddin Yassin announced a stimulus package of 40 billion ringgit or about 12.8 billion Singapore dollars. It includes cash aid for households with monthly incomes of 5,000 ringgit or less, as well as a month of wage subsidies for workers in affected sectors. Now, this stimulus package is meant to soften the blow of the lockdown because from today, only 17 essential economic sectors are allowed to operate, like F&B, utilities, transport, banking, e-commerce and communications. But these businesses can only open from 8 a.m. to 8 p.m. Socializing will be restricted as well. People are limited to travelling within a 10-kilometre radius of their homes with inter-district or interstate travel banned. And only 2 per household can go out for essential items and services. Social gatherings or house visits are not allowed as well. Joining me now from Kuala Lumpur, Malaysia Bureau Chief Shannon Teo with the latest. Shannon, welcome back to the show. How does this lockdown compare with Malaysia's past movement restriction measures like the MCOs, CMCOs and so on in terms of what is and isn't allowed, as well as how Malaysians are reacting to the latest round of rules?
Well, here's another acronym for us. A lot of people are calling this the FMCO, Full Movement Control Order. Call it whatever you want, but a lot of people are not too happy that we have to be in this position after something like 14, 15 months of fighting this pandemic. This is the worst ever wave that Malaysia has gone through. I think everyone's pretty aware of that. We nearly hit 10,000 cases a few days ago. There's been 1,200 deaths in May alone. That's nearly half of all deaths that Malaysia has recorded across this entire pandemic. So things are getting pretty serious here. So people realize that it is necessary, but they don't have to like it. I think that's what we have at hand here. Now, the way the rules work is that there is supposed to be no social activities. If you have to go out and exercise, you have to do it solo. You can't even cycle. They want you to stay very close to home so you can jog, You can do some exercises, aerobic stuff, and some of that kind of solo kind of work. No group activities, no dine-in, nothing fun, I suppose. Only 17 economic sectors are allowed to operate, and they have to operate with very strict work from home protocols, meaning only 60% of staff maximum can be at the office premises. So this is the strictest we've ever had since the first MCO, which was in March 2020 to about May last year. That was the strictest. That was right at the start, and that was very successful actually in bringing down numbers. Very soon, in June last year, we could go to what we call an RMCO, a recovery MCO, where people could travel interstates, they could go on holidays, contact sports was allowed, so on and so forth. So what the government is saying is this FMCO that we're calling it, which is stricter than this year's MCOs, but not as strict as last year's MCOs. I know it gets a bit confusing. It's necessary to bring down the numbers. Now, the Director General of Health, however, has a bit of sobering news. He's saying that based on the way the trend of infections, it's going to take us 3 to 4 months before we get out of this.
Shannon, this lockdown was brought about because the third MCO couldn't suppress the current case surge, with record numbers being reported every day. How come it wasn't as effective this time around, and how can this lockdown help address these loopholes, so to speak?
Malaysians are pretty clever at saying, oh, this rule doesn't allow me to do this, but if I did it like that, will it be okay? So for example, right now, there's no cycling allowed. But people are saying, well, if I cycle to the grocer, that's essential, right? It's my form of transport. So you can't avoid these little loopholes. There is no perfect rule. What's important is for people to understand that you have to do things. Everyone has to sacrifice certain parts of their life for this to work, whether or not you feel the rules make sense. Now, why the previous MCO didn't work when the ones earlier in the year, MCO 2 in January worked, MCO 1 last year worked. Well, the MCO 3 was pretty soft touch. Most of the economy could still continue, even though what we call workplace clusters, clusters of infections that were happening in offices, in factories, they accounted for a large proportion of cases, right? Of clusters at least. So that was allowed to continue throughout MCO 3. They only just barred social activities, dining in, and inter-district travel. So that didn't work. And it was the situation was exacerbated because we have these new variants of concern. More aggressive strains were in the country. The stuff that were first detected in India, South Africa, in the UK, things like this, they were all present in the country. And we were seeing its effects, very clear effects. The percentage of people who develop severe symptoms rose to something like 35% in April. 1 in every 3 patients would exhibit very severe symptoms. We didn't have that kind of numbers before. Before it was 10%, 20%, depending on which time of the year. Our ICUs over capacity nationwide by more than 100%. The number of beds that they've reserved for COVID patients is already more than 1,000. And right now, 850 or so are confirmed COVID patients, with another 200 to 300 which are suspected. So the healthcare system is at its breaking point. And this basically shows that whatever strain is in the country right now is a lot more powerful, a lot more virulent than what we were handling before. And so the existing measures just couldn't handle it. So we need to go deeper and stricter.
The country will be under the lockdown until June 14th. Given that it's just for 2 weeks, Shannon, how much will Malaysia's economy be affected? Is GDP still expected to grow up to 7.5%?
Well, the short answer is no. I don't think there's any economist out there who believes that we will hit the growth levels of 6 to 7.5%, which the government had targeted because it wants to return the economy to pre-pandemic levels. Now, last year's contraction was 5.6%, so they want at least 6% this year so we can get back to the way things were before. That's clearly not going to happen now. Now, the finance minister just said that there will be a downward revision, but he says it's too soon to calculate how much. But if you ask economists around, they've gone as low as 4% for their growth figures this year. My personal feeling is that that's still pretty optimistic, because that's assuming that the current lockdown works according to schedule. We are supposed to be in what we call phase 1, very strict lockdown for 2 weeks, and then 4 weeks slightly looser, and then we go into what it was, what I refer to as a soft touch MCO. After that, that's after 6 weeks. Then we go back to a situation where most economic sectors can operate, but still no social activity, no tourism, so on and so forth. So we don't know how long this is going to last, and this is going to be a drag on the economy going into the long run.
Thanks for the update, Shannon. I've been speaking with Malaysia Bureau Chief for the Straits Times, Shannon Teo. Looking at other headlines, dengue cases are expected to rise as the Aedes aegypti mosquito population has grown by 30% in April compared with January. Since the start of the year, over 2,700 cases have been reported, and there are currently 22 active clusters. All government landlords and 6 major retail landlords like Capital Land, City Developments and SPH REIT will abide by a new code of conduct aimed at making the leasing of retail premises here fairer and balanced. The code covers 11 areas including rental structure, third-party fees, pre-termination by landlords or tenants, and data sharing, and also sets out a process for resolving disputes after lease agreements have been signed. And on to sports. Amid the fallout from a boycott of all media activity at the French Open for mental health reasons, Naomi Osaka has pulled out of the event. She wrote on social media, quote, "The best thing for the tournament, the other players and my well-being is that I withdraw so that everyone can get back to focusing on the tennis going on in Paris." The world number 2 had won her first round match on Sunday and, true to her word, skipped the mandatory post-match press conference and was fined $15,000. She was also threatened with disqualification from the French Open and future Grand Slams if she continued to snub her media obligations. Osaka's decision to withdraw was supported by her fellow athletes, including Usain Bolt, Venus Williams and Coco Gauff. Voicing her thoughts on the issue, Serena Williams said she feels for the 23-year-old Osaka, adding that whether you're thick or thin-skinned, people handle things differently.
I feel for Naomi. I feel like I wish I could give her a hug because I know what it's like. Like I said, I've been in those positions. We have different personalities, and people are different. Not everyone is the same. I'm thick, other people are thin. So everyone is different and everyone handles things differently. So, you just have to let her handle it the way she wants to in the best way that she thinks she can.
And those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below. Once again, I'm Harrianto Diman. See you tomorrow on The Big Story.